Postoperative nursing care is a crucial aspect of patient recovery following surgery. The goal of postoperative nursing care is to monitor the patient's condition, manage pain, prevent complications, promote healing, and ensure a smooth transition from the operating room to recovery. Here are some key components of postoperative nursing care. Monitoring vital signs. Regular monitoring of vital signs such as blood pressure, heart rate, respiratory rate, and temperature helps nurses identify any changes in the patient's condition and respond promptly if there are any concerns. Pain management. Assess the patient's pain level using a pain scale and administer appropriate pain relief medications as ordered by the physician. Regularly reassess and adjust the medication dosage as needed. Airway and breathing. Ensure the patient's airway is clear and that they are breathing effectively. Monitor oxygen saturation levels and provide supplemental oxygen if necessary. Wound care. Keep a close eye on surgical incisions for signs of infection, bleeding, or poor healing. Follow the surgeon's instructions for wound care and dressing changes. Proper hand hygiene and sterile techniques are essential when handling wounds. Fluid and nutrition. Monitor the patient's intake and output of fluids. Administer intravenous fluids as prescribed and monitor for signs of dehydration or fluid overload. If the patient is allowed to eat, ensure they are tolerating food and fluids. Mobility and ambulation. Encourage early ambulation and movement as appropriate to prevent complications such as blood clots and muscle atrophy. Assist the patient in moving safely if needed. Preventing infection. Maintain strict hygiene practices to prevent infection. Use proper aseptic techniques when performing procedures or providing care, and educate the patient and their family about infection prevention measures. Medication management. Administer prescribed medications on time and document the administration accurately. Educate the patient about their medications, including dosage, purpose, and potential side effects. Monitoring and managing drainage. If drains are in place, monitor the amount, color, and consistency of drainage. Empty and document drainage as required, and ensure the drains remain patent. Patient education. Provide the patient and their family with clear instructions on postoperative care, including wound care, medication management, activity restrictions, and signs of complications to watch out for. Psychosocial support. Address the patient's emotional needs and provide reassurance. Surgery can be stressful, and patients may experience anxiety, confusion, or mood changes during recovery. Discharge planning. As the patient's condition improves, begin planning for their discharge. Ensure that the patient and their family understand the discharge instructions, follow-up appointments, and any necessary lifestyle modifications. Communication. Maintain open communication with the patient, their family, and other members of the healthcare team. Report any significant changes in the patient's condition promptly to the physician. Remember that postoperative care can vary based on the type of surgery, the patient's individual needs, and the healthcare facility's protocols. The nursing care provided should be tailored to the patient's specific circumstances and the surgeon's instructions. Thank you for watching this video. Do like and comments, and if you like, hit the bell icon.